Welcome all on behalf of Gujarat Government Physiotherapy Association. As an effort to enhance evidence-based practice in India, we are arranging series of evidence-based practice webinars. Today, we are going to learn about electrotherapy evidence-based practice from very well-known physiotherapy fraternity, Dr. Ashish Kakkad sir. Dr. Ashish Kakkad sir is MPT in Neuro from Civil Hospital, Ahmedabad. He is Associated Professor at SPP College of Physiotherapy, Surat. He is author of Fundamental of Electrotherapy and Biomedical Physics, a textbook of electrotherapy for us. And he has also developed and launched Stroke Recovery Predictor mobile app. So, not taking much time of all of you and handing over to Dr. Ashish Kakkad sir. Thank you.
Dr. Hardik Bhatt sir. Uh, First of all, I would like to thank GGPA for giving me this opportunity to conduct the webinar on this evidence-based electrotherapy. And let us start with our topic today without giving much of the time in introduction. Already it is given by Hardik sir. Now, I think that I am audible properly and my screen is visible. Okay, so let us start with our today's topic, that is electrotherapy evidence-based practice. So we are starting with the pain. So why we need to revise this pain? Because all of you are graduates or postgraduates. So you all have studied all these things, but this is just for revision purpose, or this is just for memorizing purpose. Because pain is the terminology that we are listening regularly at least 20 to 25 times when we are sitting in our OPD. Many patients, they are coming with back pain, knee pain, shoulder pain. So pain is the terminology that we are listening in day-to-day activity, especially when we are sitting in OPD. So let us understand the pain first, and then how we can think of use of this electrotherapy modality for pain relief. So first of all, starting with the definition of the pain. So pain is emotional and unpleasant sensory experience associated with actual or potential tissue damage, or described in terms of such damage. So what does it mean? It is affecting our emotion. Clear? So definitely the pain will be affecting our mood. Many times if you are getting call from your colleague that would you like to come for movie, or would you like to come with us for any restaurant. So if you are suffering from back pain or headache, so definitely your answer will be no. Okay, you people go. I don't want to come because I am having back pain, I am having headache, whatever. Clear? We have seen many patients, those are literally crying just because they want to get rid of this pain. Clear? So crying means what? It is affecting your emotion, it is affecting your mood. Now another thing, it is unpleasant. No one will like the pain. Clear? Have you heard any time that yesterday I was having back pain and I enjoyed a lot? Okay, it is not like that. We don't like pain. We all want to get out of the pain. Clear? So it is always unpleasant. It is not just a sensation. It is one type of the sensory experience. It is one type of the sensory experience. So definitely if it is experienced, we will remember in our memory also. So for example, if I had fall from my bike, okay, before 6 months, and I have suffered from the pain for a few weeks or few days. So definitely when I pass from that corner of the city next time, definitely I will be more careful. Why? Because I have already stored that experience into my brain. Clear? So it is one type of the sensory experience that we are getting. Clear? And generally when the pain happens, so physiologically whenever we have any type of tissue damage, okay, that may be injury or that may be any other chemical reaction. Clear? So we have damage to our tissues. So in that case we will be having pain. Clear? So it is described in terms of potential tissue damage. Okay. Now what is the purpose of pain? Why the nature has given this pain to our body? So it is having one purpose, that is protection of body. If I tell my own example, so before 6-12 months I was having knee pain when I was climbing the stairs. So when I assessed, so definitely I found that my weight was more, so I started reducing my weight. Clear? So it is nothing but it is protecting in nature. It is giving you one alarming sign that now you need to take care of this body part. Clear? So it is actually good. If we say it is good, it is having protecting nature, or it is having one alarming sign. Clear? Okay, so that we can take care of that part of body. Clear? So when this occurs, we will be responding. As I told you that I was having knee pain, so I started reducing my weight. So it is our response. Clear? So pain is stimulating us that you should respond to this particular thing in such a way that you are able to reduce your pain. Clear? Now, there are multiple factors. Those are responsible for pain perception. Clear? Reception will be same. Okay, I would like to explain with one of the example. If I have 3 students, clear, and I am giving 100 rupees to all of these 3. Clear? So, first student may be appreciating this. Okay, sir, give me 100 rupees. Second student is okay with it. Okay, sir, give 100 rupees. Third, okay, he may be angry also. What comes in 100 rupees? Okay, nothing is coming into 100 rupees nowadays. So all these 3, they are getting 100 rupees, but one is very happy, one is okay, he is neutral, and third one is angry also, that what comes in 100 rupees. So what is our observation here, that even though reception is same, all are getting same amount of the money, but the response will be different. So same happens in our pain also. All of them, okay, if they are having same intensity of the pain, their perception will be different. One will be complaining that I will be having more pain. Another will be complaining that, okay, pain is tolerable. Okay, so intensity is same, but still their perception is different. So first factor is psychological factor. So if I am having strong psychology, so definitely I will be feeling pain less. But if I am having weak psychology, I will give more importance to the pain, and definitely I will be feeling more pain. So that is our psychology. Then previous experience. For example, if I touch hot engine or hot silencer of my scooter or car, so definitely I will be having pain. But we all have seen that the persons those are working in garage, they are frequently touching these hot engines and silencers, but they are not complaining of pain at all. Why? Because they are having this experience, previous experience. In your clinical practice also, you might have observed that female patients, they are able to tolerate more temperature of paraffin wax bath therapy as compared to male patients. Why? Because females, they are generally dealing with this hot vessels in their cooking procedures, clear, in kitchen. So they have this experience. Then social. So it is your company, means with whom you are living. I have read somewhere that we are the average of 5 people among which we are living the most of the time. Clear? So if my friend circle, if my family members, they are giving more importance to the pain, so definitely I will be also giving more importance to the pain. But if my family members or if my friend circle, they are giving less importance to the pain, so definitely I will be also giving the less importance to pain. So it is my society, okay, that is also affecting my pain perception. Best example I would like to say, if you think of any wife of army person, so definitely they're also very much rigid, okay, when they are having pain, they're not giving more importance to the pain. Why? Because they are living with that type of the person who is giving less importance to pain. Clear? So here our society, our friend circle, our family members, what they are thinking, that is also having effect on us. Yeah, so that also affects pain perception. Then cultural. So it is very common that culture is different across the different regions. For example, if we think of the city people, those who are living in cities, they are wearing footwear, okay, slippers, even in bathroom. But those villagers, those are living in village, they are going barefoot even in the farm. Clear? So here it is the cultural difference. So definitely the person who is wearing slipper in bathroom, if he or she is having minor injury in the sole of foot, definitely they will be complaining. But if the person who is working in farm on, that is also on barefoot without any footwear, so definitely if they have injury to the sole of foot, they will not be complaining much. So this is cultural variation. Okay, so this psychological, previous experience, social factors and cultural factors, all these are affecting perception of the pain. Reception or intensity of the pain will be same, but still perception will be different. Now, There are two types of the pain. One is fast pain, second is slow pain. Fast pain, it is also known as first pain, and slow pain, it is also known as second pain. Now, we have classification of sensory nerve fibers. If we start in descending order, means from highest diameter to lowest diameter, or from highest nerve conduction velocity to lowest nerve conduction velocity. So it comes like this: A alpha, A beta, A gamma, A delta, B and C. Clear? A alpha, A beta, A gamma, A delta, B and C. So out of this, A delta fibers will be carrying the fast pain and C fibers will be carrying the slow pain. Fast pain means it is during the injury. If my finger is getting blocked between the door, okay, so that is during injury. So it is known as fast pain. Now when my finger is unblocked, so it is not like that I will be having pain relief immediately. Even after that, for few minutes or few days, I will be having pain. So that is the lacking pain, that is after injury. So that will be slow type. So during injury, it is fast pain. After injury, it is slow pain. Definitely the fast pain will be more severe as compared to slow pain. Now let us revise these pathway of pain transmission. Clear? So the name of this pathway is lateral spinothalamic tract. It is lateral spinothalamic tract. So it starts with receptor. There are dedicated receptors for this pain. Okay, so they are known as free nerve endings. Okay, they are known as free nerve endings. Then it is giving impulse to our first order neuron. Okay, then from first order neuron the impulse will go into the second order neuron, and second order neuron will cross to the opposite side. Okay, means from right to left or left to right. Then the second order neuron will ascend up and will be terminating at ventrolateral posterolateral nucleus of thalamus. Clear? Now from this nucleus of the thalamus, it will be entering into the cerebral cortex. So that is third order neuron. And from this third order neuron, it will be reaching to post central gyrus of parietal lobe. Okay, so post central gyrus of the parietal lobe, it is the final destination or final center for pain perception. Clear? So here the impulse is starting from free nerve endings, then it reaches to first order neuron, then it reaches to second order, then third order, and then final center, that is post central gyrus of parietal lobe. So here, why we are revising this pathway? So here it is like, if we are able to stop this pain transmission at any level before it reaches to post central gyrus of parietal lobe, we are giving pain relief to our patient. Clear? It is simply like whatever we see in few movies, that if any eyewitness is not able to reach to court, so definitely the criminal will not get any punishment. Why? Because of lack of information, because of lack of evidence. So here also pain will be perceived or pain will be felt at conscious level when it reaches to post central gyrus of parietal lobe. So anyhow, we have to stop this pain before it reaches to post central gyrus of parietal lobe. Is this clear? Okay, now there are few causes of pain. So examples are ischemia. Ischemia means it is lack of blood supply. Best example, ischemic heart disease, that is heart attack. Okay, then chemical stimuli. So that is because of accumulation of lactic acid, especially when we are getting fatigue. Okay, for example, or you are coming in contact with any strong acid. Okay, so that is one type of the chemical stimuli that will be initiating your pain stimulus. You can think of spasm also. Spasm, that all we know, it is a protective guarding of muscle, and mechanical, like that is because of positional fault. Okay, like osteoarthritis, back pain, etc., etc. And polymodal. Polymodal means multiple causes are there together. Then also take revision of referred pain. So referred pain means it is origin of the pain is somewhere else, but another organ is feeling pain. Clear? So that is known as referred pain. Okay. So for example, diaphragm pain will be felt to right shoulder. Okay. Heart pain will be felt over the left side of the chest as well as left side of the arm. Gallbladder pain will be felt over the epigastrium region, and kidney pain will be felt over the loin. Ovary pain will be felt over the umbilicus, and testis pain will be felt over the pubic region. So what is the mechanism behind this? So you might have observed that deep pain will be referred superficially, but the superficial pain will not be referred deeply. Okay, what is the reason behind this? Why the origin is somewhere else and feeling of the pain is somewhere else? So it can be explained like this. For example, diaphragm. So it is supplied by phrenic nerve, and the root value of the phrenic nerve is C345. So right shoulder, it is also having, or shoulder, it is also having a root value of C345. Clear? So brain will feel that pain is coming from shoulder, okay, but actually the pain is coming from heart. Clear? So it is having same root value. Why there is same root value? So the reason is we will have to go into histology. Whenever any organ it is developing from neurilamal tube, so they will be having particular nerve supply. So if the two organs they are developed from single part or specific part of the neural tube, okay, so definitely they will be having common nerve supply. Clear? So if they are having common nerve supply, so definitely the brain will be receiving this pain stimulus from superficial organ very easily. Clear? So actually the pain is coming from diaphragm. So definitely it is coming from C345. But the brain will receive like that type of the signal that it is coming from right shoulder. Why? Because it is also having nerve supply of C345. Clear? So this is known as dermatomal rule. So if they are having same nerve supply, brain will feel that the pain is coming from that particular dermatome. Dermatome means it is the area of the skin that is supplied by that particular nerve root. Now, the neurotransmitter responsible for pain transmission is substance P. Now, this is the classification that you need to understand. Now, pain modulation means it is regulation of pain, how to control the pain. So that is known as pain modulation. So you can think of all of your physical agent, electrotherapy modalities. Okay, so they are classified here, how they are working. So pain modulation, mostly it is classified into three, that is heat, cold, or by masking the pain by other ways. So that is in form of currents. Clear? So heat is again further classified. You can follow this pointer. So it will be superficial heat and it will be deep heat. So the superficial heat, it is again divided or classified into three, that is conduction, convection, and radiation. So what is conduction? Conduction means we will have to understand 1 to 2 lines for physics here. Conduction means the particle is getting heated, but that particle is not able to move. Clear? So what it will be doing? The heated particle will transfer the heat to nearby particle. Now this particle will give heat to again nearby particle. So this is how it is spreading the heat. So definitely it will be for solid materials. Clear? So best examples of conduction is paraffin wax bath. So when you apply the wax bath over the skin, so wax itself it is hot. Okay, so it will transfer its heat to skin, and from skin it will be transferred to fascia, and here it is how it is spreading and going inside the body. Clear? Same is applicable for hot pack. So they are working on conduction. Just because they are hot, they will transfer the heat. Then comes convection. So convection means what? So it is basically for fluid and gas. So if the particles they are getting hit, so this heated particles will move, okay, and they will transfer the heat, okay, because they are free to move. They are not bound as it is in solid. In fluid and gases, they are free to move. So heated particles will move and will transfer the heat. Best examples related to physiotherapy, they are hydrotherapy and fluidotherapy. Then comes radiation. So radiation means it is non-contact method. Okay, you don't need to be in contact with your patient. Clear? So it will be transferring by any medium, or even without medium also they will be passing. So they are best example of electromagnetic rays. Clear? These are electromagnetic rays. Examples are IR, that is infrared. Okay, UVR, that is ultraviolet rays, and MWD, microwave diathermy, and laser. Okay, so all these are examples of superficial heat. Now we are thinking of deep heat. So whenever you have any region that is having pain that comes from deeper part of the body, okay, so we need to think of shortwave diathermy and ultrasound. Because of their high frequency, they will be penetrating more. Okay, just remember that formula. Z is equal to 1 upon 2 pi fc. Okay, so that is impedance of body. 1 upon 2 pi f means frequency. Clear? So definitely impedance and frequency, they are inversely proportional. More the frequency, less the impedance. Less the frequency, more the impedance. Clear? So here, more the frequency, less the impedance. Definitely less the impedance, more the penetration. Impedance means resistance. So definitely if any area is providing less resistance or less impedance, penetration of that particular electrotherapy modality will be more. Clear? So high frequency currents, okay, like shortwave diathermy, ultrasound, they will be penetrating more. Okay, then comes cold. So best example is icing. Okay, icing may be in form of ice pack or vasocoolant spray. Okay, it is up to you. Okay, but the thing is, it is cold therapy that we are giving, or cryotherapy we are giving. Then third is classification, that is masking pain. So that is IFT and TENS. Clear? IFT and TENS. Now we have to classify, okay, this pain modulation on four aspects. One is peripheral level, then spinal level, supraspinal level, and cortical level. So as we discussed, that pain will be felt consciously only when it reaches to higher center. If we are able to stop this pain before it reaches to this higher center, definitely we will be able to give pain relief to our patient. Clear? So first is at peripheral level. Peripheral level means we are stopping the pain before it is stimulating your free nerve ending. Clear? Before it stimulates your free nerve ending of this tract of pain, we are inhibiting it. Clear? So that is at peripheral level. So heat therapy and cold therapy, they are working at peripheral level. How? So they are increasing blood supply. Okay, they are removing the waste metabolites. That will come in detail also. Clear? So at peripheral level, we are avoiding this pain to be transmitted up to the receptors. Before that only, we will be curing it. Okay, how? So here it is the answer: heat therapy. So what this heat therapy will do? So definitely the heat therapy will cause vasodilatation. Whenever you have vasodilatation of this blood vessel, so definitely more blood supply will be to that particular body area. Okay, and definitely it will be providing more oxygen, more nutrients, more antibodies, more protein. Yeah, so all this will be supplied more, so definitely it will promote healing. Okay, another is, as the new blood is coming, okay, old blood will be drained. Okay, so the blood that may be having more amount of lactic acid or any other waste metabolites, those will be drained. So definitely the patient will be having pain relief. So this is the simple fundamental of heat therapy. Then cryotherapy. So here there will be vasoconstriction, and after that there will be vasodilatation. So definitely it is also providing new blood, okay, and all blood will be drained. So definitely it will be also relieving pain by providing, again as we discussed, more oxygen, more nutrients, more antibodies, more amount of amino acids. So ultimately promoting healing, and it will be removing the waste metabolites. Now, so it was about peripheral level. Peripheral level means before the pain is stimulating your prenerve endings, before it stimulates your receptor. Now, another level comes, it is at spinal cord level, spinal level. So the now pain has already reached to receptor and it has entered into the spinal cord. Now, how to stop it? So it is by pain gate theory. So pain gate theory, it is, we have to consider the transverse section of the spinal cord. In the spinal cord, we have small parts, okay, just to understand. So they are known as lamina. So in lamina 5, you have this substantia gelatinosa. You have substantia gelatinosa and T cells. T cells, they are also known as wide dynamic range cells. WDR means wide dynamic range cells. So any sensation, including pain, will have to travel from this T cell. Clear? Then and then they will be reaching to third order neuron and finally to the center. Okay, so we can say that it is the common checkpost from which the pain has to travel along with all other sensation also. Clear? Now, there is one assumption that substantia gelatinosa is inhibiting these T cells. Now, what is the logic here? T cell is allowing the pain to transmit. Now, I want to stop the pain. So, anyhow, I have to inhibit the activity of T cell. Now, if I want to inhibit the activity of the T cell, what should I do? I should stimulate the substantia gelatinosa. Clear? It is like policeman and thief. If the police is activated, thief will be deactivated, or if the police is deactivated, thief will be activated. Okay, so it is having inhibitory control. So just to inhibit the T cell, I need to stimulate the substantia gelatinosa. But how to stimulate substantia gelatinosa? So that is by large diameter fibers. Now we know that A delta and C fibers, those are carrying this sensation. Now as per classification from highest to lowest, it is, as we discussed, A alpha, A beta, A gamma, A delta, B and C. Now A delta, so diameter more than A delta is A alpha, A beta and A gamma. So I need to stimulate any one fiber out of this three, A alpha, A beta and A gamma. Clear? So that will suppress the activity of A delta and C fiber. Clear? So if I am giving TANS or IFT, it is stimulating A beta fiber. So A alpha, A beta is stimulated. So all the remaining will be inhibited. Clear? So if A alpha, okay, that is not stimulated, A beta, it is stimulated. So A gamma, A delta, B and C, they are not getting stimulated. Okay. So we are stimulating A beta fibers by giving this TENS and IFT. So that is working on pain gate theory. So in short, stimulation of large diameter fiber will stimulate substantia gelatinosa, and stimulation of substantia gelatinosa will inhibit the T cell, and inhibition of the T cell will avoid the pain transmission. So definitely the pain will be stopped at your spinal cord level only. It is not reaching to your brain. Yeah. Another mechanism is physical blocking. So when you give TENS or cryotherapy, so it will reduce the nerve conduction velocity. So definitely pain is also one type of the impulse that has to travel from the nerve. So by providing TENS or cryotherapy, you are reducing the nerve conduction velocity temporarily. So definitely you will be also getting less transmission of the pain. Why? Because you have reduced the speed of this pain. Clear? So patient will be feeling pain relief. Clear? So physiological blocking system means you are blocking that sensation by reducing its nerve conduction velocity. That is nothing but speed of impulse. Then supraspinal level. So the mechanism here, it is DPSS, that is descending pain suppression system. So just ask yourself, if you are getting injury, if you are getting pain, and if you are not taking any medicine, or if you are not doing anything for that, so do you think that that pain will be lifetime? Answer is no. Okay, it will be healing by itself. Okay, our body is self-repairable. Okay, it is self-repairable. So there are natural synthesis and release of this transmitters. Okay, neurotransmitters and neuromodulators, those will be working as analgesics. Clear? So after injury, if the blood test is done, so this type of the chemicals are found in our blood, that is serotonin, enkephalin, endorphin, dynorphin. So these are natural painkillers, we can say. Okay, we don't need to purchase from chemist store. It is naturally synthesized and released. Clear? So it is known as descending pain suppression system. Then comes counter irritation. Counter irritation. So, for example, we all are seeing these commercials of Moo and Volini. Okay, so all these are working on pain relief by topical application. So, do you think that it will be working on back pain? Because our disc and vertebral body, all these are 5 centimeter deeper from our skin, where we are rubbing this ointment. Clear? So this ointment is not reaching 5 centimeter deeper, but the thing is they will start sensitizing your superficial nerve endings. So under control, definitely under control, you are producing superficial pain. Okay, or you are producing burning sensation. Clear? So definitely that will mask the deeper pain. Clear? So superficial pain or superficial burning type of the sensation or irritating type of the stimulus, that will suppress the, or that will mask the deep pain. So that is nothing but counter irritation. We are not talking of that particular gel or ointment in physiotherapy, but we are talking of TENS, because TENS will be providing the same effect of counter irritant. Okay? Placebo. Placebo means by using unfamiliar drug or vitamins or sometimes even machines, novel machines. I have seen many times that even when ultrasound machine itself, it is not providing ultrasound, but if you give or if you use that machine on patient as if you are giving ultrasound, so the light will be on, sound will come, but the ultrasound is not coming, but still patient will be reporting pain relief. Why? Because patient is feeling that okay, I am getting some treatment. Okay, so psychologically patient will start feeling pain relief. Clear? So it is by use of unfamiliar drug or vitamins. Many times this is practiced in various centers, that when the doctor is confident that this problem is not having any somatic origin, it is just psychosomatic origin or hysterical, so they are giving this medicines. Why? Because the patient will feel that with medicine I will be cured, but actually it is not medicine, it is like supplement, vitamin tablets or something like us. Clear? But still it is approved by pharmacology and ethically also it is not wrong. So you can think of that placebo. Many times there is argument among our physios also, because many times patients they are telling that okay, sir, last time when I was having back pain I took IFT, so it gave me relief. At present you are giving me short wave diathermy, can we try IFT? Okay, because it gave me relief last time. Clear? So many times we are telling that okay, you are patient, you don't know much. Okay, I am the physiotherapist, I know everything. Okay, let me do by myself, but actually it is not like that. Okay, you give treatment as per your protocol definitely, but if the patient has preference of particular modality and if you feel that it is not contraindicated, you should do it, because it is nothing but placebo. Okay, same medical practitioners they are also doing. Sometimes few patients they are asking for injections instead of medicine, so they are giving injections. Few patients they are refusing for injections and they are asking for medicine, so they are giving medicines also. Clear? So there is nothing wrong in doing that. If the patient has preference of particular modality, definitely we should go with it. Definitely it should be adjunct, it should be add on. The proper therapy, whatever you have decided, that should be also continue. Now at cortical level means the pain has already reached to post-central gyrus of parietal lobe. Now what to do? So you can think of behavior modification. Clear? So patient needs to think that I don't have pain or I have less pain, because if you think more, definitely you will be feeling more pain. So definitely you need to suppress it just by your thoughts. Then by meditation, so definitely you will be diverting your mind. Okay, instead of brain I am using the word diverting our mind. Clear? So we are not concentrating on pain. Then use of frank atmosphere. Many times we have seen that there is long queue in many clinics or in surgeons hospital, and at the same time few they are just sitting idle. Okay, why? Because these people they are having very frank atmosphere in their clinics or OPDs or hospitals. Clear? And they're also talking very well with the patient, they are listening, because just listen to your patient will reduce the patient's pain. Okay, just listen them properly. Clear? So that will reduce their pain. Okay, and many surgeons I have seen that they are putting their hand on the patient's head. Okay, they are just patting on the back. So this all are examples that by using the frank atmosphere you are helping your patient for pain relief as well as for promoting recovery. And last is laughter therapy, so that will be releasing serotonin. Okay, so laughter therapy will be working as one of the painkiller. Okay, and you all have seen laughter therapy in that movie Munna by MBBS by Dr. Asthana. So it is working very well. Okay, laughter therapy. Now, coming to the core part of this lecture, which modality is best for my patient? Okay, so selecting modality is as complicated as finding the correct road from this crossing. Clear? Because what is the problem? Because for single indication, we have multiple choices. Okay, that is generally lacking in medicine part. Okay, in that also there are few complications or few medicines those are responsible for or those are to be used for single indication. Clear? For example, antibiotics. So there is always debate which antibiotic should be given. Okay, But for antiviral, for example, few antivirals are there, so there is no choice. Okay, this disease, okay, herpes only as severe. Okay, if it is Parkinson, it is levodopa. Okay, so likewise in that also it is there. For few disease they have only single medicine, and for few disease they have multiple medicines. Clear? So same happens in physiotherapy also, but in physiotherapy it is on one side. For single indication we have multiple choices. Okay, we are not having that type of the facility that okay, this disease, okay, you have only choice of this modality, this cannot be given. Okay, it is not like that. Okay, we have multiple modalities for single indication. So just for example, if the hypothetical case is taken here, patient will tell that I have knee pain. Okay, so again, electrical activity will start in my brain, and that gives me multiple ideas. Like, okay, I will tell that okay, I should try shortwave diathermy for you because it will give best pain relief. Again, I will be thinking, let me try microwave diathermy also because it is also giving pain relief. Again, my brain itself will give third idea, why not IFT? Then fourth idea, TENS may also be tried. Again, fifth idea, ultrasound will be also better, but definitely I cannot give all of this. Okay, then I will be confused what to do because there are multiple options and I have to select one or two out of this. Now finally what I will do, so definitely my answer should be I should go with evidences. I should go with research. Okay, because whenever I want to go for mediclaim of my patient, definitely I need evidences. Now focusing on evidences. So here in the screen you can see the comparison between the shortwave diathermy and pulse shortwave diathermy. Clear? And you will be reading all these references here. Okay, just below the conclusion of this study I am writing the references, so you can read in detail if you want to read after this lecture. Clear? So whenever the continuous shortwave diathermy and pulse shortwave diathermy was compared for low back pain, so it was found that pulse shortwave diathermy was more effective as compared to continuous shortwave diathermy. Then when it was comparison between the shortwave diathermy, IFT and TENS. Clear? So in this study, definitely one of this agent was used. So that is physical agent, shortwave diathermy or IFT or TENS. Along with that, exercise was also given and education programs like ergonomics, do's and don'ts, okay, all these were also given. But when there was statistical analysis, so it was found that the shortwave diathermy or interferential therapy or TENS, all these are equally effective. No difference was found among TENS, IFT and shortwave diathermy for pain relief. Then, when there was comparison between the shortwave diathermy and ultrasound, especially on the patient of osteoarthritis of knee. So again, no significant difference was found when these two groups were compared to each other. Two groups means one group of shortwave diathermy and another group of ultrasound. Now, when there was comparison among shortwave diathermy, hot pack or TENS. Clear? So here hot pack was combined with TENS and hot pack was also combined with shortwave diathermy. Clear? So this was like combination hot pack plus TENS or hot pack plus shortwave diathermy. Clear? So hot pack with TENS has best outcome as compared to hot pack with shortwave diathermy. Clear? So this is like combination. Now, when there was comparison among shortwave diathermy, ultrasound and phonophoresis. Phonophoresis means it is, as you know, it is application of drug with ultrasound. Generally, we are using diclofenac along with the ultrasound, so it is known as phonophoresis. Okay, ultrasound means it is simple. Sonophoresis means only sound waves. So again, there was no significant difference among these three modalities in terms of its efficacy on pain relief, okay, on the patient of osteoarthritis knee. Now, I did not find any evidence which compares shortwave diathermy and microwave diathermy. So I have just mentioned the theoretical differences. Okay, so those you can read out. okay, related to their frequency, electric field, and penetration of this fatty layer, okay, and what is the probability of creating hot spots on our skin, okay, and related to spacing as well as materials required, okay. Generally these are the theoretical differences, but we cannot say that which one is superior as compared to another one. Then when there was comparison between the shortwave diathermy and infrared rays, so definitely it was found that shortwave diathermy has better effect as compared to infrared rays. But infrared rays, they are also effective. Okay, it is not like that IR is not effective. IR is also effective, shortwave diathermy is also effective. But when there is comparison, shortwave diathermy was more effective as compared to IR. Now, when there was comparison between TENS and IFT, so if we talk of pain relief, so there was no significant difference. Definitely, the TENS is having less penetration depth as compared to IFT. So, in terms of deep pain or superficial pain, this may create some variation, but otherwise, both are equally effective. TENS or IFT, both are effective, but both are equally effective. And when there was comparison between ultrasound and wax bath, so the study is concentrating on carpal tunnel syndrome. So when the ultrasound was given with wrist orthosis, so it was more effective when it was with paraffin wax bath and wrist orthosis. So wrist orthosis was common, so we are discarding it. So we can say that ultrasound is more effective as compared to paraffin wax bath. Ultrasound is more effective as compared to paraffin wax bath. Now, when ultrasound was compared with laser, so here also ultrasound was found better as compared to laser. It was checked on lumbar discopathy, so that is lumbago or low back pain. Yeah, so ultrasound was more effective as compared to laser. Again, I repeat, ultrasound is more effective than laser. It does not mean that laser is not effective. Both are effective, but ultrasound is more effective. Now, again, debatable topic, heat versus cold versus contrast. Clear? So here it is interesting. Heat versus cold versus contrast. What does it mean? Clear? So generally by research, by evidence, it was found that whether you apply heat or whether you apply cold, okay, or whether you applied contrast bath. Clear? Now contrast bath, it is not just by using two bowls and putting one bowl with hot water and another with cold, and then again you dip your foot inside it, okay, alternatively. Nowadays this hot pack and cold pack both are used, like in case of knee replacement, on medial side there is hot pack, on lateral side there is cold pack. Okay, medial, lateral, hot pack and cold pack. Again, after 1-2 minutes, there will be change. On single knee, again there will be change. Clear? Again there will be change. So this is also contrast bath. So whenever you want to check efficacy of heat versus cold and versus contrast, so it was checked by research also on osteoarthritis knee patient. So it was having interesting result, that results were better when the modality was used of patient's preference. Like few patients may tell that I'm feeling more relief with hot, and few patients may tell you that I'm having more pain relief with cold. Okay, and few may be having more pain relief with contrast bath. So it is based on patient's preference as compared to physiology behind this hot and cold and contrast. So definitely we should accept this. Now, few consideration we have to consider here also. It's not like that always the patient is given choice regarding their selection of hot or cold. Okay, there are few consideration, those we need to follow. What are they? So first is cold treatment reduces inflammation by decreasing the blood supply initially. So it should be used in acute phase. So first 2-3 days, no heat therapy, only cold therapy. Past 2-3 days or acute condition, okay, after injury, it is only cold therapy, no heat therapy, because heat will increase the vasodilatation and will further increase the inflammation. So for acute, only cold. Okay, then heat treatment promotes the blood flow, so definitely it will relax the muscle and it will promote the healing also. So for chronic pain, you think of hot. So for acute cold, chronic heat. Then heat therapy will be beneficial for stiffness relief. So if you are thinking of any joint, like patient complains of knee pain or shoulder pain, so that is joint. So over the joint, definitely the cold will increase the stiffness. So we should think of hot therapy. Okay. Heat and cryotherapy both will be useful for pain relief. Both will be useful for pain relief, but we have to consider these aspects, those already be considered. Clear? So to reduce inflammation or swelling, you go with cold only. For acute, you go with cold only. For chronic, it is heat only. Clear? Okay, but for pain relief, you can think of both. Okay, it is up to you and for patient's preference. Okay, whenever you are giving this hot therapy, so you take care of the temperature because our skin will start burning after 44 degrees Celsius. Okay, so it is not advisable to maintain contact. Like for example, if you are using hydrocolloidal pick, so that may be having temperature up to 70 degrees Celsius. So it is not to be in direct contact with your skin. Definitely, we are putting towels and all or napkins. So there should be proper spacing. Okay, same for eyes also. Never give directly on the skin. So even the ice packs, those who are purchasable from market, they are having also one cover. Okay, so ice pack is put inside the cover and then it will be applied to patient's body part. Now, conclusion. How I should select the electrotherapy modality. So definitely based on patient's parameter. We have to consider patient's parameter by assessment. Let me explain with one simple example. If the patient is of back pain, but when you assess patient is having pain only over the SI joint, so we can think of ultrasound, it is fine. But if the area is covering whole lumbar region, okay, or whole low back, so definitely ultrasound will not be effective. Why? Because the ultrasound will cover less area. You need to give to more area of whole low back. So you can think of shortwave diathermy or you can think of microwave diathermy. Okay, now if the back pain is there along with radiculopathy, means back and lower limb, they are also affected. So definitely shortwave diathermy will not be possible to give. So you can think of IFT or TENS also. Clear? So you can think of IFT TENS in case of lumbar radiculopathy. So the patient was having same problem, low back pain. But if it is low area, okay, we are thinking of ultrasound. If it is moderate area, we are thinking of shortwave diathermy. And if it is still larger, radiating pain, so we are thinking of this, that is IFT or TENS. Clear? So it is based on patient's parameter. Then it is based on therapist convenience also. Like if I think of microwave diathermy, so it is very costly. If I think of laser scanner, it is very costly. So definitely it will not be afforded by everyone. But few other modalities are available. Those are giving sometimes even better result. As we discussed, ultrasound was giving better result as compared to laser. So we can think of that. So it is up to therapist convenience also. And both of these factors will lead to selection of proper modality. Now these are few terminologies. Those may be encountered in day-to-day clinical practice. Allodynia, so there is pain perceived by non-noxious stimuli, that is by touch, pressure, etc. Analgesia means it is loss of pain. Causalgia means it is painful burning sensation along the distribution of nerve. Dysesthesia, so that is simply touch, only touch. Okay, touch sensation will be perceived as pain. Hyperalgesia, so that is increased sensitivity to pain, and hypoalgesia, so that is decreased sensitivity to pain. Paralgesia means it is abnormal pain sensation, especially along the distribution of nerve. These are a few penetration depths, those I have found from different literature. So microwave diathermy will be penetrating up to 6 to 8 centimeter. Phonophoresis will be penetrating up to 5 centimeter. Ultrasound with 1 megahertz head will be penetrating 5 centimeter, but with 3 megahertz will be penetrating 2 centimeter. Shortwave diathermy up to 3 centimeter and sometimes even throughout the body part. Clear? So it depends on your width of body. So it is sometimes passing throughout, but minimum 3 centimeter it will be penetrating. Hot packs, heating pads, paraffin wax bath, infrared and fluidotherapy, they are penetrating even less than 1 centimeter. So that is again to apply our logic here. If the pain is more than 1 centimeter deeper, We are not supposed to use this hot pack, heating pad, paraffin wax, or infrared or fluidotherapy. When we give, definitely it will give relief. Why? Because it is of counter irritation. But actually, we are not treating the part that is to be treated. And different therapeutic currents. So it is based on the skin resistance. So definitely it varies from patient to patient. So generally it is 1 lakh ohm to 1000 ohm depending on wet skin or dry skin. So, and even in the wet skin or dry skin, it differs from person to person. So more the skin resistance, lesser the penetration, and opposite frequency. So more the frequency, less the impedance, and more the penetration depth. So in short, we can say that more the frequency, more the penetration. More the frequency, more the penetration. It is applicable for currents, not for ultrasound. Okay, then it depends on electrode placement. So if you are keeping two electrodes very near, the depth will be less. If you are putting with more space, they will be having more area of penetration depth. Okay. The references used for this lecture is physiology done by Sambulingam, then electrotherapy explained by Low and Reed, then neurological rehabilitation by Darcy Fed, and fundamentals of electrotherapy and biomedical physics by me. These are all the additional reading links related to this lecture, so you can search into this for getting more knowledge. And if you want to attend more of the lectures, you can search my name Ashish Kakkad in YouTube, and you will be getting other lectures also. And I hope that this lecture was not like this, that whatever I spoke, it is vested. Clear? And if you have any question, you can ask in comment box. Thank you. And over
Thank you,
to
Ashish
Dr.
Bhai.
Hardik sir.
Thank you, Ashish Bhai. It was a very nutshell thing because it is a very wide topic. There are so much of modalities and so much of condition we are dealing. So it
Yes.
is very difficult to fit the perfectly all the things. But it was a roadmap that was very useful to all of us. Few questions already we have collected, and I want to discuss with you.
Sure.
Just like combination therapy,
Hmm.
Ashish sir,
Yes,
many
sir.
using like IFT
Huh.
giving simultaneously with ultrasound and two modalities using simultaneously. Is there
Hmm.
any evidence of it, or is there any way to use any combination to enhance the results?
So definitely we can use the combinations. First of all, it is saving our time. And second thing, for
Okay.
example, if I talk of ultrasound and IFT, so theory it is telling that if the IFT is delivered, okay, so that therapeutic current is already delivered to patient. So whenever we are giving ultrasound also along with it, so it will reduce the threshold. Okay, so I can say that IFT is given and simultaneously I'm giving ultrasound. So with less intensity of ultrasound also I will be giving more effect of ultrasound, because
Okay.
already the
Okay.
particles they are in movement, and in that I am giving ultrasound. So definitely it will be working with more efficiency and with less intensity. Yes sir.
Okay. Okay. So that will be useful for saving time also, right?
Yes,
Mm.
it will save physiotherapist time, and nowadays patients time
Yeah.
also, because nowadays patients they're also coming
Yeah.
with
Yeah.
that psychology that I want to be free earlier. Initially it was different. Yes.
Yes. Yes. Yeah, we do have a very long treatment sessions. So
Yes.
sometimes patient skips the physiotherapy session that I don't have so much time today, so I
Yes.
won't go to the physiotherapist today,
Yes. Yes.
right? Yeah.
Exactly.
And Ashish sir, second thing, some things are coming like long wave diathermy, shock wave therapy.
Hmm.
That is things that are coming in market with different names and different parameters.
Hmm.
So, what is your view on all these therapies and
Uh,
modalities, which
yes,
are
sir.
generally not part of a regular physiotherapy or electrotherapy list?
Yes, sir. Sir, actually, these are the new things. So definitely we should follow. We should be updated. But if we think of evidence-based practice, so I am finding no particular evidence that tells that long wave diathermy is more effective than any other modality. So
Okay.
long wave therapy, it is okay, it is effective, but it's not like that it is more effective as compared to other therapy. But what is the
Okay.
concept
Okay.
behind this development? So long wave therapy also works on 1 megahertz as per my knowledge. So 1 megahertz, it is also frequency of ultrasound. So when we give
Okay.
ultrasound, so actually the patient is not feeling anything. In ultrasound, many times the
Okay.
patients, they are telling that I am not feeling anything. Clear? Even though it is working, patient is not feeling. So in case of long wave diathermy, the patient is feeling heat. Okay, so
Heat. Yeah.
frequency is same. Okay, and the structure is also like same also. So the head will be of that long wave diathermy probe, you can say. Okay, so that we have to move or we have to stabilize on patient's body part. So it is giving 1 megahertz frequency and along with heat. So we can say that it will be patient's preference to take this long wave diathermy. But evidence,
Oh,
I have
okay.
not found that it is more effective than any other therapy. And regarding the
Yeah. Yeah.
shockwave therapy, so that is also effective. I have come across many patients; those are telling, but market value of this instrument is too high.
Yeah.
So
Yeah.
it will be not
It's not
affordable.
affording for every therapist. Yeah.
Yes, not for therapist as well as even not for this patients also. Because if
Patients.
the cheaper
Patients
options
also.
are
Yeah. Right.
available, definitely we should go with that because budget matters everywhere.
Okay. Yes. Yes. Definite. Definite. So the basic of tools of electrotherapy are sufficient to deal with any type of need of ours. So just we want to stay updated with it. Definitely, there will be a lot of bunch of questions on this topic because we are you have nicely tried to keep all these things nutsells. But definitely, the topic is so wise. We will have so many of questions, and we will catch you again if needed for it. And
Yes,
thank you so much
sir.
for your valuable time, sir. And it was very informative. And we are looking for more updates from you definitely in future also. Thank you
Sure,
so much,
sir.
sir, for
And
your
sir,
time.
let me clear one more thing. Electrotherapy should be always used as one adjunct. It is one type of the
Okay,
add-on treatment. It is
okay,
not just
okay, sir.
whole treatment. Clear? So
Yes,
whatever
sir.
you
Yes.
are using like stretching, strengthening, mobilization, okay, it may be started after 2 3 days after starting this electrotherapy because we want to deal with pain. We don't want to increase the pain. So that is different thing. But electrotherapy is not whole and solve. Okay, it is just to be
Okay,
used as one adjunct or add-on treatment. Another thing, even though electrotherapy is giving temporary relief, it should be tried. It should be used. Okay, it's because many times it is the argument that electrotherapy gives temporary pain relief. So I'm explaining my students with simple example that one student, I'm giving practical demonstration to them. I will be selecting two students. I will be giving chalk to one and duster to another one. And I will be giving task to first student that you have to write 1 to 100 on this board. And if someone is deleting, you have to write from first again. Okay. So just think that he is writing one and second student will rub it. Again, he will write one and second will rub. So definitely he will never be able to complete his 100. So I think you are getting my point because if there is no other student who will be deleting all these messages from board, so definitely your another student or first student will be writing from or he will be able to complete 1 200 means the pain is increasing, and if we are not masking this pain, even though it is temporary pain relief, but if we are not inhibiting this pain, so pain will be reaching to its severe level, and then definitely we will be failed to give this pain relief. So even though it is temporary, we should use it, and another, it should be used as add-on treatment. It is not substitute of exercise therapy.
Yeah, definitely. Yes,
And
yes, sir. Yeah.
sir, I conclude here. And thank you so much again, Hardik sir and GGPA, to give me this opportunity for conducting this webinar. And I will be pleased to answer your questions.